Hi guys, welcome back to my podcast. It's called Grabbing Coffee with Arun, ARUN, where I talk to everyday people that are doing interesting things. And today my guest is Sandra Rowland. Sandra used to be a nurse in New York, and I find it kind of interesting to find out more about nursing. So just to kind of start off with, Sandra, welcome.
Good evening. Nice to
So,
be with you.
so, Sandra, tell me a little bit about nursing. You said you were like a critical care nurse, right? So can you tell me a little bit about what that is? And
So, I worked 40 years as a critical care nurse,
Mhm.
and critical care nurse is a nurse that takes care of and focuses on critically ill patients
Mhm.
um, that are in the intensive care unit. Where I worked was the unit after they had open heart surgery and had it, the critical care patients have to be monitored very closely, you know, with plenty of machines and things attached to them. Some of them are on ventilators to help them breathe, um, amongst other type of machines. So each critical care patient usually has like one nurse. So it's
Mhm.
usually one nurse to one if it's a very ill patient, or one to two patients. And you usually don't have more than that. Whereas a regular registered nurse that works on a nursing unit with they might have five, six, seven patients assigned to them. Those patients aren't critical. They can sometimes do things for themselves. And, a lot of them are ambulatory up and about, where critical patients are not. They're confined to the bed, they're on lots of machines.
So how did you get interested in nursing, Sandra?
I think I I think from when I was a little girl, my mother had a sister that was a registered nurse. And every evening when she would be, dressing up, getting a white uniform on, I would just sit there and watch her, and since I was small, I said, I'm gonna be a nurse when I grow up. So that's what I did. When I
So,
was a teenager, I'm
uh
sorry.
no,
When
go
I
ahead.
was a teenager, I was fortunate to have like summer jobs working in hospitals.
Hmm.
So I got a little taste of it before I even went to college.
I guess it takes a special person to be a nurse, right?
I
So,
think so. It can never be about the money. It always has, you have to really want to be a nurse, want to help people. I think it was no other job in this world for me. Because you're providing a service, you're helping people, and it's a rewarding job also.
but I hear it's a big shortage of nurses in the U.S., right? Why do you think that
Yes.
is? Or
I think it's because nowadays a lot of people are not going to school for nursing.
hmm
Well, for one thing, back years ago, they used to have schools that were just for have to have a college degree. You go to a nursing school
hmm
and you would end up with a diploma degree. And then from there, if you wanted to pursue your education, you could go on to college and get an associate's degree or a bachelor's or master's, whatever you wanted. With the diploma nurses, they still were able to be registered nurses. They just didn't have that college degree. I think like in the 80s, they were moving towards getting rid of a lot of nursing schools.
hmm
From what I can see down here in Houston, Texas, there are still nursing schools, which
hmm
specialize just in nursing. But they were trying to move away where they required you to have a degree, whether associates, and then they wanted you to have at the least a bachelor's degree.
Yeah,
So,
it seems like it's very competitive to get into one of those schools too, right?
yes, yes. Well, for me, I think you have to have a good background in science and also in math
Hmm.
because there is a lot of math in nursing, you know, and the sciences, of course. The pharmacology part of nursing, that's dealing with, the medications, that requires a lot of math. They have a lot of formulas that you have to follow for calculating medications.
Hmm.
I mean, it's advanced since I was in nursing,
Hmm.
starting nursing, because now they have all of these machines that you punch in the
Right.
and it's all calculated for you. When I say drugs, I don't just mean pills. I mean, the medications that they put in the IVs. So a lot of that is much easier to calculate now, but you still need to know like some of the formulas for calculating certain things.
Hmm. Because
So,
now I hear all these different nurses, like, LVN, RN, and what's the difference between all that? Because when I think of a nurse, Sandra, to be honest with you, I think of somebody that takes blood pressure before the doctor gets to you, you know,
hmm
and your vital
so
signs and all that.
right. So, well, that's not all that nurses do. I guess that's what a lot of people think. And I think now that's more of the job of the medical assistant.
All right.
They
Okay.
do that. When you say LVN in New York, they're called LPN. They're licensed practical nurses. I don't know what the V down here in Texas stands for, but I think it's similar. So you could be a LPN
Hmm.
and basically do the same job as but there were certain things that you could not do in the hospital as a licensed practical nurse, and that would be number one, to give blood. You couldn't give blood and to the patient, and like you couldn't give a lot of the IV medications, but basically everything else you could do. So basically, when I'm talking about the job as a critical nurse, I'm talking about in the hospital. But for me,
Hmm.
there are a lot of other um, things you can do with nursing. You can work in doctor's offices. You can work in like businesses, because they always have a nurse there for
Hmm.
employees. They have industrial nurses, they have school nurses. So it's a lot of things you could do in nursing, also research nurses. And nursing nowadays has a lot of place for growth. You could be a nurse practitioner. The
Hmm.
big thing now are people going on to higher education to become nurse anesthetists, where
Hmm.
they give anesthesia, and that's a really high paying job. So a lot of people want to get into that also. And
What
that's basically you're going to work in the operating room.
what is a nurse practitioner, Sandra? Because I hear that a lot. I hear that term a lot. Like some people, somebody might say a nurse practitioner. What does that mean?
Right. So a nurse practitioner is a practitioner.
Hmm.
It's equivalent to not a doctor, but a physician assistant. They
Hmm.
could they're you need a master's degree for that. Um, they could work and function on their own. They could run their own clinics, but they're working up under the guidance of a doctor. They can
Hmm.
order medications, but it also has to be signed off by a doctor. So each nurse practitioner is up underneath a doctor.
Hmm.
So, but they're able to function on their own. They can have their own patients. Some insurance companies won't, you know, pay for you to have just a nurse practitioner as your basic primary care provider.
Right. So
But then there are
do you have to be a nurse for a while to become a practitioner? I
no,
guess you.
some people could go straight through. They could. come out of high school, do their college education, 4 years, get their bachelor, and then continue on to get their master's
Mm-hmm.
in nursing. And, at the same time, they could become nurse practitioners. There are a lot of nurse practitioners in the hospitals now, and also in doctors' offices. You have a lot of nurse practitioners.
So what was the challenging thing about your job? What did you find that was
Challenging?
difficult? I guess dealing with people is not easy, right?
No, exactly. So I think for me, a
Hmm.
lot of times more challenging than, you know, making sure care of really good. Sometimes the families of these really critical ill patients can be very challenging, you
Hmm.
know.
Yeah,
So you also, besides your patient, you have to, you know, have a way of calming the, families down, reassuring them, of what's going on, explaining things to them,
right,
know, walk past them like they don't exist, kind of tell them what's going on so they could feel more comfortable. So besides the patient, you're dealing with the families. And sometimes families can be difficult too. But then you have to also remember, that's a very stressful time that their family member is critically ill. So that was one of the challenging things I had
right.
seen.
So what about like I hear a lot of, I'm not trying to be what do you call it, biased or anything, but I hear a lot of Filipino women are into nursing, right?
Yes. So not only Filipinos, but I think back in the 70s and really in the 80s, there was
Mm-hmm.
such a shortage of nurses that hospitals, say like the private hospitals, would go to the country, the Philippines, also Jamaica, and those places, and they were recruit nurses. They would bring and they would pay for them and help them along if they stayed working at their hospital, like they would sign a contract to work for that hospital for a certain amount of time, they would help them get their green cards, their citizenship. So, that's how it started, like back in the 80s. And from then, it just grew, more and more people came from different countries because certain hospitals you go to, it might be like a lot of Indian nurses. It might be another place, a lot of Jamaican nurses, a
Right.
lot of Filipinos. And then after a while, they would bring other family members here. They would stay, start their own families that some of their kids would go into nursing. And that's how it was. But I think it really kind of started back in the 80s when they went to other countries to recruit nurses. And that was the incentive for them to come here where they would get their citizenship and their green cards. They just
Oh,
had
that's it.
to sign on, they would give them housing, you know,
Hmm.
back then. So they had an incentive to come, and a lot of them wanted to come for that reason. So
So
I think that,
what about like, oh, that's interesting. What about like traveling nurses? Can you tell me a little bit more about that? Have you had any experience with that or?
oh, yeah. So in the hospitals usually sign up nurses that are traveling nurses. Now,
Mhm.
traveling nurses, a lot of them are doing it for the money, but not only for the money. A lot of them want to like try out different places to work, and some of them want to see where they want to settle down. Say like you're a nurse here in Texas and you travel to New York, you know, if you like it, you might settle and start working there, become full-time staff member of that. But then some people just like to travel different places. Now, travel nurse, when they sign up with a travel agency, um, they usually are given like a place to stay, unless
Mhm.
they prefer to find a place on their own. Um, and their health insurance sometimes is paid for by the agency, and sometimes the nurses might have to pay for it themselves. But they make a much higher hourly salary than a nurse that's already on staff at a hospital,
Right.
just because of those things, because of, paying their own health benefits sometimes. And they seem to like it. I've met a lot of travel nurses over the years. Usually they start off taking like a 3-month assignment. That's their contract. They
Mm-hmm.
work at that place for 3 months, wherever there's a shortage. If that's the area they want to work in, they sign them up. If they like it, they could extend their contract, or at the end of 3 months, they could leave and take on another assignment someplace else. A lot of times I've seen nurses work for 3 months, leave, and then maybe the next year you might see that same person come back to work there again. So it's,
Oh,
I think, good for some people. A lot of them don't have children and they don't mind moving from place to place. People who have families, I don't think they do too much of the travel nursing thing, you know, because it's just moving place to place like every couple of months.
right. I guess it's be good for a younger person, right?
Not Some of them are not just young.
Right.
And then, like when COVID started, oh, travel nurses, they were really able to clean up on salary.
Mm-hmm.
Number one, when COVID came, a lot of nurses retired. A lot of nurses got sick and some died. And so they had a real big shortage. So it was, beneficial for a nurse to go into travel because they were getting paid such high salaries because hospitals were so short of staff,
Mm-hmm.
and the agencies really paid them a lot. And after that, a lot of them stayed travel nurses, after, COVID was finished. So
So, Sandra, you have a lot of experience in nursing. What would you tell like a younger person that wants to get into nursing, especially these
I,
days?
well, I think it's a good, career to go into
Mm-hmm.
because, for one thing, you'll always have a job someplace.
Mm-hmm.
There's always a need for a nurse. I just think it takes a special type of person, to be a good nurse. You have to have compassion. You have to have good knowledge of different things. And you just have to enjoy being around people.
Yeah.
Like I said, it's a very rewarding job. When you have good outcomes, you feel the benefits of all the work that you've put into it.
Yeah, because the Texas Medical Center is fairly large, so I'm sure there's
Hmm.
quite a few nurses here, right?
Right. So, from what I see, it looks like they have a really good nursing school. So, a lot of people aren't going into nursing just because they could become a medical assistant, you know, and um, start working in a shorter period of time. But at the same time, they don't get to do everything that nurses do. It's a lot that nurses do, that people just don't see,
Mm-hmm.
you know, from the outside looking in. You collaborate with doctors and other people on the health team, nutritionists, physical therapy. You always have your input
Mm-hmm.
in, the care of the patient. It's not just the doctor making all the decisions, writing the orders. A lot of times doctors will come to nurses and ask, for their opinion or, what they think. So that also is a good part of nursing.
Are you guys taking notes for the doctors too, or does the doctor do they do their own notes while they're
No,
taking notes?
doctors do their own notes.
Oh, do
So nurses do notes and doctors read the notes,
they? Mm-hmm.
but doctors make their own notes also. Nurses make their own notes. So now, when I first started nursing, we wrote out our notes.
Mm-hmm.
right?
Now everything on the
Now,
computers.
in the 90s, when computers came, all your notes are put into the computer. So, that being said, it's much easier for doctors to, read the notes. That's number one. Number two, there's no more paper charts. You know how when you go in the doctor's office before, you see a lot of charts,
Right.
filed in place with paper. They got rid of all of that. So notes are all computerized now. And it's
Right.
much easier for, all entities of the healthcare system to, um, see what's going on. That's why now they have my charts.
Yeah,
Like just
the
about every hospital has my charts. Like New York, I had a my chart, and then when I came down here, the doctors I have here, they have my charts. So it's easier for them to read each other's notes and see what's going on. Say like you go to a cardiologist and a primary care, they can easily read each other's notes in the computer and
right.
with my chart. So
There's
that's
a
much easier than when we used to write out our notes.
yeah, there's a company called Epic. I think they do all that.
Oh, yes. Yes.
That's a big.
So there's a lot of like different programs, but Epic is the number one, I think, um, uh, computer program for a lot of medical places now.
Do,
That's
do,
the one I used to use in my hospital. I see they use that also like at Methodist when I've been down here.
yeah. One last question I got for you is, do you think that nursing schools have gotten a little bit more tough to get into? That's from what I gather. They're not easy to get into.
No, they're not. They're not easy to get into. But like I said, like, well, basically my experiences in New York, most of New York has gotten rid of the plain nursing school.
Hmm.
So like you can go into the colleges that have nursing programs. So even though you're going for your bachelor's, for instance, right?
Hmm.
That's one curriculum you have to do, or your prerequisites before you can even start the nursing part of the program. So maybe like the first 2 years, you're taking mostly like your sciences and things like that. And then by your third year, you're going to start in going into the nursing portion, where as you go into the hospitals. I actually worked in the 90s as a clinical instructor at a nursing school. Also, that was
Hmm.
just an extra job I had. That was a really rewarding job. It's almost I can almost say, like, the students are so interested in becoming nurses, they want to just suck out all your knowledge that you could give. You take the students into the hospital, you show them how to do a lot of different things, your little group, you assign them patients and you help them. I love that job, just being a teacher and helping them with their um, journey on to being a nurse. It was just, I loved it. It's
Yeah.
almost like you have a bunch of little kids and they clinging to you because it's
Hmm.
their first time in the hospital taking care of patients,
Right.
So,
But
yes.
Sandra, if I had to go back, I did accounting as a profession. If I had to
Mm-hmm.
go back, I think I always tell my family that I guess I could become a nurse or something.
Yes.
Seems like a
So
very,
I
very
think
exciting
like
field.
maybe back in the early 90s, a lot of men were getting into nursing.
Hmm.
Okay. That's number one. And a lot of people was taking nursing as a second career, such as firemen, people that were into computer, you know, some of them used to be nutritionists. They took
Hmm.
nursing as a second career. I noticed that. But a lot of male nurses are in nursing now. So, you know, back in the day, you didn't see too many male nurses. Now you see them all the time.
Right, right.
Hmm.
Anyway, Sandra, was there anything else that I think we covered everything pretty much, huh?
Yes.
Yeah.
Yes.
Yeah. Thank you very much, Sandra. If you guys want to reach me, my email is Arun, A-R-U-N dot G-A-A-L-L-A at gmail.com. Thank you, Sandra, and
Okay.
thank you for your
Uh,
service, and thanks for all the good information you gave me.
Okay.
You have a
Thank
nice
you for having me,
you have a nice
speaking
evening.
with me.
All
You
right.
too.
Bye-bye.
Bye bye.
Bye.